My name is Rachel Chandler. I am 33 years old and live and work in Bucks County, PA. I have cerebral palsy, which mostly affects my legs, and I use a motorized wheelchair to get around. I'm here in support and advocating for paid family and medical leave. According to the article, key elements of the Build Back Better Act's paid family and medical leave proposal, explained by Vicki Shibo, a few primary ideas are 4 weeks of paid leave which can be expended intermediately or all at once. Secondly, sealed wage replacement which will make paid family and medical leave more attainable for low wage workers or middle wage workers. Making paid family and medical leave a part of Biden's plan will benefit the Social Security Administration and the programs they provide people. This is therefore a positive for people with disabilities and elderly people. Eligibility conditions for paid family and medical leave include current work history and earnings, certified paid family and medical leave reason for leaving a job. This leave can be due to a recent child or needing to care for a family member with a serious health condition. Titled article, The Disability Community Needs Paid Family and Medical Leave by Rebecca Coakley and Diana Bosch, says there are approximately 61 million people with disabilities that rely on paid family and medical leave to help with their needs. My family takes care of family. My family means everything to me. I've been lucky to have them as a great support system through all my obstacles. Having a disability all my life, as I've gotten older, I've come to realize that people with disabilities are constantly battling, sometimes multiple things. Battling about our care, battling about benefits, battling about transportation, about access and employment. All these different issues that may arise for someone takes time to figure out. I experience some of these issues daily and work with people with disabilities and discuss solutions to these issues every day. A quote from Vicki Shibo's article states, "The Build Back Better Act's paid family and medical leave guarantee will be historic and transformational. It would fundamentally change U.S. policy, encourage greater partnership with state government and the federal government and the private sector, and begin to establish a culture of care that reflects the needs of people, families, and businesses. What paid family and medical leave means to me is a sigh of relief. It gives someone time. People with disabilities need to be included in this conversation. Why were people with disabilities not included in the population of people to receive emergency leave during the coronavirus when it was available to others? 12 weeks of leave were given for childcare and not for medical necessity or care providing purposes. This was eventually altered to include people with disabilities, but why were we an afterthought? It will also have an enormous impact on caregivers, both informal caregivers and professional personal care attendants. If they are given the time off they need, they will come back more refreshed, enjoy their job, do it better, and want to stay. This is then a benefit for the client because they don't have to worry about them leaving. Not everyone realizes how hard it is to find reliable caregivers. This will also benefit home and community-based services, which people with disabilities have been advocating for and trying to improve. Adding people with disabilities to this conversation is vital and should not be an afterthought. Many organizations have small numbers of employees, and having paid family and medical leave could be a viable option, especially for someone like me with a disability. Yes, I receive paid time off, but what if I needed more time to take off due to my health? Many people with disabilities don't have the option of receiving it because of only working part-time or doing low-wage work. The Family Care Act and paid family and medical leave could allow them that option. According to Chibo's article, paid family and medical leave is one of the more essential terms in the Build Back Better plan. We're talking about people's lives and making people's lives better. Why would that even be a point of discussion? When it comes to anything that can support the American people, it should be the number one priority. It brings a smile to my face that people with disabilities are part of this conversation, because there are a lot of us, all with different situations, that could benefit from this.